Hey gorgeous people, welcome back to my channel. Today, we're diving deep into a skin concern that so many of you have been asking about: melasma. Tired of those stubborn brown patches stealing your glow? This video is your comprehensive roadmap to understanding and effectively treating melasma, revealing expert tips and a powerful skincare routine that delivers real results. Melasma is a common skin condition characterized by dark, irregular patches, typically appearing on the cheeks, forehead, and upper lip. It's crucial to understand that melasma isn't just surface-level hyperpigmentation. It's a deeper issue involving overactive melanocytes, pigment-producing cells. This condition is significantly more prevalent in women due to hormonal influences. Key triggers include sun exposure, hormonal shifts during pregnancy, known as cloasma, the use of birth control pills, genetic predisposition, and even stress. Identifying your triggers is the first step in effective management. Unlike typical sunspots or post-inflammatory hyperpigmentation, melasma's deep-rooted nature means that superficial treatments often fall short. To truly address melasma, we need to target the melanocytes at a deeper level and prevent further pigment production. Treating melasma requires a comprehensive strategy combining professional medical treatments with a consistent and targeted at-home skincare routine. Let's explore the most effective options. These treatments are best administered and monitored by a board-certified dermatologist. They offer potent solutions for stubborn melasma, but require careful usage to minimize potential side effects. Hydroquinone, 2–4%. Considered the gold standard, hydroquinone inhibits melanin production. However, it's crucial to use it in cycles, for example, 3 months on, 1 month off, to prevent potential side effects like ochronosis, paradoxical skin darkening. Tretinoin along with azelaic acid. This combination boosts cell turnover, helping to shed pigmented skin cells, while azelaic acid further inhibits melanin production and reduces inflammation. Tretinoin can be irritating, so start with a low concentration and gradually increase as tolerated. Oral tranexamic acid. A relatively newer treatment, oral tranexamic acid helps reduce pigmentation from within by inhibiting the production of plasmin, a substance that stimulates melanocyte activity. This requires a prescription and careful monitoring by a physician. Chemical peels. Gentler chemical peels, like those containing mandelic or phytic acid, can help exfoliate the skin and reduce pigmentation without causing excessive irritation, which can worsen melasma. Glycolic acid peels can be too harsh for melasma-prone skin. Laser treatments such as Picosaur or Fraxel can be effective for stubborn melasma cases. However, they should only be performed by experienced dermatologists, as improper use can lead to rebound pigmentation, worsening of melasma. A consistent and well-formulated at-home skincare routine is essential for managing melasma and preventing its recurrence. Here's a step-by-step guide. AM routine means it's your morning routine. Cleanse. Start with a gentle, non-stripping cleanser to remove impurities without disrupting the skin's natural barrier. Look for cleansers that are sulfate-free and pH-balanced. Vitamin C serum. Apply a vitamin C serum containing L-ascorbic acid, 10–20%, to block pigment production and provide antioxidant protection against sun damage. Choose a stable formulation and store it in a dark, cool place. Niacinamide. Use a 5% niacinamide serum to reduce the transfer of melanin to skin cells and improve the skin's barrier function. Niacinamide also has anti-inflammatory properties, which can be beneficial for melasma. Sunscreen. Most important. Apply a broad-spectrum mineral sunscreen with SPF 50+ containing zinc oxide. Mineral sunscreens are less likely to cause irritation than chemical sunscreens. Reapply every 2 to 3 hours, especially when exposed to sunlight. PM routine means it's your night routine. Double cleanse. Begin with an oil cleanser to effectively remove sunscreen, makeup, and sebum. Follow with a gentle cleanser to ensure all residue is removed. Exfoliate 2 to 3 times per week. Use a gentle exfoliating product containing lactic acid, 5%, or koic acid soap to remove dead skin cells and promote cell turnover. Avoid over-exfoliating, as this can irritate the skin and worsen melasma. Now, Apply your dermatologist-prescribed treatment cream, such as hydroquinone or tranexamic acid serum, on dry skin. Wait 10 minutes before applying other products to allow for optimal absorption. Moisturize. Finish with a ceramide-based cream to repair the skin barrier and prevent moisture loss. A healthy skin barrier is essential for protecting against environmental aggressors and preventing irritation. And now, secret tip. Layering your skincare products in the correct order is crucial for maximizing their effectiveness. Always apply products from thinnest to thickest texture and wait 5 to 10 minutes between applying active ingredients to prevent irritation and allow for proper absorption. Here are some game-changing tips and common mistakes to avoid when treating melasma. Ice roller. Before creams, cooling the skin with an ice roller before applying your treatment creams can help reduce inflammation and improve the penetration of active ingredients. Sunscreen hack. Mix a small amount of zinc oxide sunscreen with your foundation for added sun protection. This is especially helpful if you wear makeup regularly. Diet matters. Incorporate foods rich in lycopene, tomatoes, vitamin E, almonds, and omega-3 fatty acids into your diet to help fight pigmentation and support overall skin health. Biggest mistakes. Using too many actives at once. This can cause irritation, which can worsen melasma. Introduce new products gradually and monitor your skin for any signs of irritation. Skipping sunscreen, even indoors. UV rays can penetrate through windows, so it's essential to wear sunscreen even when you're indoors. Over-exfoliating. This can weaken the skin barrier, making melasma darker and more difficult to treat. Limit exfoliation to 2 to 3 times per week and use gentle exfoliating products. Let's address some of the most frequently asked questions about melasma. Can melasma be cured permanently? While there's no permanent cure for melasma, it can be effectively managed with consistent treatment and diligent sun protection. Think of it as a chronic condition that requires ongoing maintenance. Can I use retinol with melasma? Yes, retinol can be beneficial for melasma by promoting cell turnover and reducing pigmentation. However, start slowly, 1 to 2 times per week, and always pair it with a moisturizer to prevent irritation. What's the best natural remedy for melasma? Licorice root extract is a gentle brightener that can help reduce pigmentation. Look for skincare products containing licorice root extract as an ingredient. Alright viewers, I hope you found this video helpful and informative. Remember, consistency is key when it comes to treating melasma. Stick to your skincare routine, protect your skin from the sun, and be patient with the process. If you found this video helpful, smash that like button, share it with a friend struggling with melasma, and subscribe for more skin secrets. Drop your biggest skin struggles in the comments. I read every single one. Until next time, stay glowing. Bye.